Hello, everyone. Good evening to you all. So, good evening to you all. Welcome. I'm hoping that my audio visual is good for you people. Can you hear me? Kindly mention in the message, chat message. Somebody is writing in Chinese. सर एक गाना हो जाए. So is the audio okay? Right. So today's session is on the arterial supply of the upper limb, and it will be about 1 hour we will be discussing. In the last 15 minutes, we can have a chat, especially if you wish to ask some questions regarding the upper limb or maybe regarding your preparation, then we can have a chat. Okay, great. So as we talk about the upper limb, let us begin with the embryology, and it is to be understood. See, these are all MCQs. These examiners, they are going to ask us MCQs. We must be ready for them. For example, upper limb artery develops from which embryological source? And your answer should be 7th intersegmental artery. Let me zoom this area a little bit. So you have to understand that when we are talking about the development of the upper limb arteries, the answer is 7th intersegmental artery, cervical. It will be giving us the branch, and then they can ask you, it will persist as. So you should say axillary artery, brachial artery, and as you go down, it will be anterior interosseous artery. They will ask you about anterior interosseous artery specifically. So you can mention anterior interosseous artery is the access artery remnant. Now what happens is that after some time during development, there will be ulnar artery coming towards the ulnar bone and radial artery coming towards the radial bone during development. And as you see, radial artery will be slightly proximally given, as you can find here. This is the radial artery, which is quite proximal compared with the ulnar artery, which you can see here is slightly distal. So this is two arteries given from the axis artery and near the elbow joint. And then in the later stage, you can find, as we go on to this diagram, finally the adult situation will be available to us. And as you see, we have one axillary artery in the axilla, then it will be becoming, say this will be axillary artery. In the axilla, it will be becoming the brachial artery, and then so we continue. There are some glitches in the network sometimes, so can't help it. We will continue now. Now here in this diagram, what you find is that we are going to add some more details to the arterial supply of the upper limb. You have to remember that when it comes to the upper arterial system, you have to start from the heart. From the heart, you will have the arch of aorta. From the arch of aorta, you will get some arteries for the head neck region, and one of that is the subclavian artery. You see, this is the subclavian artery, called so because it goes under the clavicle, and as it crosses the outer border of first rib, it will enter the axilla to become the axillary artery. Let me zoom this up a little bit here, and as you will notice, we are focusing upon the right-sided arterial tree here, and you can see now this is the first rib here. Now as it is the first rib attaching to sternum bone, it is crossed by the subclavian artery superiorly, and then it crosses the outer border of first rib to enter the axilla, become axillary artery. Now this is the axillary artery, as you can see, and as it crosses the lower border of teres major here, you will find it will enter the arm, and then it is called as the brachial artery. So axillary artery is in the axilla, whereas in the arm you will have the brachial artery. Now let us continue with the brachial artery, and it will be becoming a content of the cubital fossa. Let me take you towards the cubital fossa, which is in front of the elbow joint. This is right-sided elbow joint, so it will be the cubital fossa here. Then it will give two branches. If it is a branch which is following the ulnar bone, it will be called as the ulnar artery, and as you can see, it is the one which is going to form superficial palmar arch. Whereas the one which is running with the radius bone is called as obviously the radial artery, and radial artery, as we said earlier, it will be forming the deep palmar arch, and then will be some multiple anastomosis. Now this is just the basics. Actually, I'm just preparing you for further details which can be numerous. For example, when we are talking about the axillary artery, it will have 3 parts and 6 branches. The first part will give 1 branch, second part will give 2 branches, and third part will give 3 branches. Can you write in the chat what is the name of the artery coming from the first part of the axillary artery? Question 1. Question 2, that artery, is it going to supply mammary gland? Kindly write in the chat. Yes, superior thoracic artery, correct. So is the superior thoracic artery going to supply the mammary gland? And the next question, is the superior thoracic artery participating in scapular anastomosis? Okay, great. So we want to have all those details, and we can move on to the next diagram for the details. As I suggested, all these questions, whatever we discuss, they are basically coming in the exam. Now, as you see, we will find here, this is the surface marking of various arteries. We just mentioned that there is this clavicle bone, and passing under clavicle bone will be subclavian artery. There is a subclavian vein also. Remember the relation. See, normally the veins have thin wall. It is better to keep them superficial or anterior, whereas the artery will have thick wall, so it is better to keep it posterior, and because it is quite thick. So initially the subclavian artery is posterior and subclavian vein is anterior. But now you see the relation. The subclavian artery, as it comes in the axilla, becomes the axillary artery. Similarly, subclavian vein, here it will be the axillary vein. And if you say it is axillary vein here, you can see, I'll zoom the area little bit here. This is the front view of the right-sided axilla, and you will see now the vein is going lateral. This can come as a question. One more question can be asked. The 3 cords of brachial plexus in the axilla are named according to relation with the axillary artery. And what are their names? So 3 cords of brachial plexus in the axilla are called as lateral cord and medial cord and posterior cord in relation to the axillary artery. We will see those diagrams shortly. But here, as you follow the radial this axillary artery down, you will notice that at the lower border of the teres major, it will be changing into, the name will change, brachial artery. But before it becomes brachial artery, it would have given a branch which you can see here, and this branch is going to the posterior side, and it is a deep artery of the arm, so we'll call it as profunda brachial artery. And profunda brachial artery is going posterior to the humerus bone, and it is following a nerve also. The nerve is called as radial nerve, and radial nerve with the profunda brachial artery will be passing behind the bone humerus in the radial groove. Now, as you follow this brachial artery down, let us take it towards the cubital fossa region. There is a question, it will be asking this brachial artery now. As you are following the brachial artery in the cubital fossa, what is the relation with the other structures like tendon of biceps, or there are some nerves here? So we'll see a diagram where you can find the relation of brachial artery in relation to the radial nerve and the median nerve. You know, brachial artery, you keep your stethoscope here to hear the Korotkov sound, to take the blood pressure superior to cubital fossa. So it will be this location where you are putting the diaphragm of the stethoscope to hear for the Korotkov sound. Now, as we proceed, Korotkov sound. So as we proceed further, you will notice this is the radial artery. Some questions will come. As you follow this radial artery here, you notice that radial artery is used for taking pulse. you have to use the 3 fingers and the index finger towards the heart, and then you can feel the pulse of the radial artery at the lower end of the radius bone. And after that, this radial artery become a content of the anatomical snuff box, goes posterior to the hand and then punctures the first web space to come anterior and become deep palmar arch. I'll repeat it once again. After zooming this area, let me show what is happening here is that this is the radial artery, and it is to be felt here at the lower end of the radius, and then it will be going posterior, winding around the radial styloid process and become a content of anatomical snuff box, and then it comes back into the hand to become the deep palmar arch, and then it will be anastomosing the superficial palmar arch. The superficial palmar arch, which we have learnt, is given by this artery here, the radial artery. You can see this is the ulnar artery coming now, and as the ulnar artery comes from the cubital fossa, it will be entering the palm to become superficial palmar arch. You may find that I am repeating information here, but each line which we are speaking about is important. There is a Allen test also which will check the patency of ulnar artery. If you do reverse Allen test, then you can check the patency of the radial artery. So we'll be talking about one question which came on the Allen test regarding these patency of the arteries and the communication between the arches by drawing a diagram ourselves as well. But here, as we are proceeding further, these days what happens is there are some cadaver based questions. So let me take you towards the cadaver kind of details. Let me just see if okay, so sound is okay. Right, so let us move on to the next diagram now. Here you will find that we are having a fracture clavicle and the subclavian artery was bleeding, and since there is a bleed, you can stop the bleed. How do you stop the bleed? Where do you compress the artery? You use your thumb and you will be going to posterior triangle of the neck and compress the artery on the superior surface of the first rib. You can see here, this is the first rib we are talking about, and on the first rib superior surface past the subclavian artery. So you are blocking the subclavian artery. Now here is the subclavian artery. Let me show you the details. First part of the subclavian artery, which is proximal to this muscle called as scalenus anterior muscle, and the scalenus anterior muscle, if the artery passes posterior to that, deep to that, second part of the subclavian artery, and when the artery comes distal to the scalenus anterior muscle, third part of the subclavian artery, and it is the third part of the subclavian artery which will be passing superior to the first rib. This is where you compress it. So we are compressing the third part of subclavian artery on the superior surface of the first rib, which lies distal to a muscle called scalenus anterior muscle. So here, this is the scalenus anterior muscle which divides the artery into 3 parts: proximal to the muscle, deep to the muscle, distal to the muscle. And I told you, where is the vein lying? The vein is anteriorly present. So which vein is this? This is none other than the subclavian vein. And subclavian vein, when it is crossing outer border of the first rib, what will you call it as? See, these structures, they are now going to enter the axilla. So axillary vein and axillary artery as they cross the outer border of the first rib. Now let us go into details. This subclavian artery, first part, there are some branches which we have to discuss further. Now the diagrams are going to become slightly detailed and maybe complicated, but then we have to take care of some details here. And as you will notice, looking on the neck region, actually clavicle area, you will find that this is the right-sided vessels we are talking about. So which vessel are we talking about? You will see that there is this artery, and that artery is the subclavian artery, and we want to talk about the first part of the subclavian artery. And this first part of the subclavian artery is going to give us width branches, VIT. In the width branches, what is this V for? As you see, the first part of the subclavian artery giving us the width branches, and this is one branch which is going up the vertebral artery. Let me zoom this area little bit now, and as you see, we are looking at one artery which is proximal to the muscle, scalenus anterior muscle. So first part of subclavian artery, and it is giving one branch which is going upward here, and that is the vertebral artery going towards the circle of Willis. Then VIT, what is I for? I comes down towards the thorax, and it is called as the internal thoracic artery. So you can see this is the one which comes down, and it is called internal thoracic artery or internal mammary artery, as it is going to supply the mammary gland on the thorax. So VIT, what is T for? T is here the thyrocervical trunk. Now when you say the T is the thyrocervical trunk, this thyrocervical trunk itself will give us SIT branches, and in the width, the T will give SIT branches. So in the SIT branches coming from thyrocervical trunk, what is this S for? The S is for one artery which is coming from thyrocervical trunk towards the scapula, superior to scapula, and this artery which is going towards the scapula here is the suprascapular artery. It is going to participate in scapular anastomosis also. So S, SIT branches S. What is I for? I is the inferior thyroid artery. As you will notice, this is the inferior thyroid artery, which is the branch of the thyrocervical trunk. And what is this SIT branches T for? T is the transverse cervical artery. And as you see, this is the transverse cervical artery here. Now, we have learnt width SIT branches. First part of subclavian artery giving the width branches, V for vertebral artery, I for internal thoracic artery, and T, it is the thyrocervical trunk, which itself gives SIT branches. S, suprascapular artery, I, inferior thyroid artery, and T, the transverse cervical artery running transversely in the neck region, hence the name. Now, we have to move further for some more details. As I was talking about, there will be some cadaver-based diagrams coming recently. So if they are coming to you, they are not marked like as you see here. They are not like that, but I am showing you some diagrams to have an idea. Then I'll show the actual cadaveric diagram also. Obviously this is a cadaver, but we have colored it. In the exam, coloring is not there. So what are we looking at? It is the front view of the right side of the neck region. There you have the brachial plexus. Roots are C5, C6, 7, 8, T1. It is the root of C5, 6 which will join, and as the root of C5 and C6 join, they will be forming the upper trunk of brachial plexus. And what is the root value of middle trunk? Middle trunk is C7. And what is the root value of lower trunk? Brachial plexus in the neck region, posterior triangle of the neck. And you will find it is C8 and the T1 forming lower trunk. Now, each trunk will give anterior posterior division and passing behind the clavicle bone. Then they enter the axilla, and when they enter the axilla, they'll form the three cords of brachial plexus. I told you they'll be related to the axillary artery. Their names are related to axillary artery. But before you discuss all that, see here, this is the artery we were talking about. Which artery will be in the neck region? Subclavian artery. So this is the subclavian artery, as you can see, and it is in the neck region, and once it will enter the axilla, then it will become axillary artery. Let me magnify this area little bit now and tell you again the details. You will find that we were talking about the root of C5 and root of C6. What are they together forming? The upper trunk of brachial plexus in the neck region, posterior triangle of the neck region. And then what about the C7? As you see, C7 will continue as the middle trunk of brachial plexus, and C8 T1. If you say C8 T1, then you'll find that they are joining to form the lower trunk of brachial plexus. Now tell me, what will happen if the upper trunk is pulled? In a patient, there will be a palsy called as the Erb's palsy. And what if the lower trunk is pulled? Then it will be called as Klumpke's palsy. Now, what is the relation of lower trunk with the subclavian artery? As you see, the relation of the lower trunk with the subclavian artery is quite close, and that is in the neck region. But now you have to move towards the axilla, and as you come into axilla, you'll have the axillary artery. Let us talk about the axillary artery as well. And this is where you will be actually facing some problems. See, the thing is, in the exam, you are getting the diagrams like this. This is again the front view of the right side neck region, right axilla region. And the problem is, in the exam, when you find such a diagram, then how will you identify that which one is artery or a nerve or a vein? So maybe in the dissection hall, you can feel it. You can see the colors, slight differences there, but here everything looks the same, and that is a problem. Examiner asking cadaver-based questions in a computer screen is a difficult job. But anyway, you will have some, criteria. Like here I can see, if you wish, I can zoom it a little bit more. What I see is that there is one branch coming from the artery which has been cut. Actually, arteries will always have lumen. If you feel, there will be some empty space, lumen. But the nerves are axons, bundle of axons. There is no space. So they will be appearing, feeling. The lumen is present in the arteries or veins. Arteries, thick wall, veins are thin wall. Veins will be usually collapsed, but arteries will be patent. So this is how you can identify arteries from the nerves. But in the computer, it's not possible to that much. Anyway, so what are we looking at? Let us first have the orientation. I told you it is the right-sided structure, and that is where you'll find we were talking about this artery. Now this is the axillary artery in the axilla, and I can show subclavian artery becoming the axillary artery. Now if that is the axillary artery in the axilla, what is the relation of the three cords of brachial plexus in the axilla? That is what comes as a question. You see, the names are like that. If the cord is lying lateral to the artery, then it is lateral cord of brachial plexus, as you will see here. And if the cord is lying medial, then medial cord of brachial plexus. And then if the cord is lying, as you see, posterior to the artery, then it will be called as the posterior. Now the thing is, maybe here it is clear, but how do you make out it here? So the thing is, in these kind of diagrams, you have to remember the relation. Let me show you how to identify various cords of brachial plexus in the axilla in relation to this artery, which we have shown, subclavian artery becoming axillary artery. So as you find, now let me show you, see, as it is, what we have done is we have pulled this artery slightly so that we can see the posterior cord which is posterior to this artery. Let me start from there only. This is the posterior cord of the brachial plexus in the axilla, and giving some branches, as you will find. One of the branch is called as the radial artery, radial nerve, sorry, and the other is called axillary nerve. So may it be the axillary nerve or radial nerve, they come from the posterior cord of brachial plexus, which will lie posterior to the subclavian artery. Now this is the posterior cord. Fine, got it. What about the lateral medial cord? So as you will see, there is this lateral cord also. We can show this is the lateral cord. Let me change the color to a deeper color. So this is the lateral cord, and lateral cord will be lying lateral to this axillary artery and continues as the musculocutaneous nerve. So this is how you can identify the lateral cord. And what about the medial cord then? As you're talking about the medial cord, you will see this is the medial cord lying medial to the artery and continuing as the ulnar nerve. So ulnar nerve is the continuation of the medial cord. What about the median nerve? How do you form the median nerve? Median nerve is actually formed by contribution from the two cords of brachial plexus. It is the medial cord giving contribution, it is the lateral cord giving the contribution, and then together they'll form the median nerve. So here is the median nerve. Somehow the median nerve will be lying anterior to this artery, which is the axillary artery. Now maybe this thing becomes quite complicated for you, but the thing is that orientation should be remembered. Subclavian artery, which is going to become axillary artery, will be related to the three cords of brachial plexus. If it is medial to the artery, medial cord continuing as the ulnar nerve. If it is lateral to the artery, then it is lateral cord of brachial plexus, which is not only continuing as the musculocutaneous nerve but also contributing to median nerve. Median nerve, which is lying in front of the axillary artery, will also be contributed from the medial cord. So lateral cord, medial cord together giving roots to form the median nerve. Then where is the radial nerve and the axillary nerve? See, if it is the axillary nerve or radial nerve, they would have come from the posterior cord of brachial plexus, which you could see only if you remove this artery. This artery was here, so you have removed it here. Then only you could see the posterior cord of brachial plexus. Now maybe you are just checking the audio, so you're getting a little bugged up that what is this dissection diagrams and all that we have seen quite long back, and it is difficult to remember. But anyway, our job now is to kind of revise here, because you have to remember the 6 branches of the axillary artery here and the 3 parts of axillary artery. The axillary artery is divided into 3 parts. How? By a muscle which comes from the ribs towards the scapular bone. And what is the name of that muscle? That muscle is called as pectoralis minor muscle. So let me zoom this area now and do some revision right from the beginning. You can discuss some of the details. You will notice that as we find, this is the heart giving us the arch of aorta. And what is the arch of aorta giving? It will give 3 branches, and first branch is the brachiocephalic trunk. Now, as you talk about this brachiocephalic trunk, it is called so because it will divide into 2. One is right subclavian artery, one is right-sided common carotid artery, and we are following the right-sided subclavian artery. There we could see some width branches. What was V for? The V as you see, is the vertebral artery. And what is this branch which is coming down to thorax? That was the I, internal thoracic artery. And what is the T branch? T is the thyrocervical trunk, itself giving 6 branches. And what are the 6 branches? As you see, we are talking about the 6 branches. You will find there is one going superior to scapula. So we'll call it as the suprascapular artery. And 6 branches I for? I will be inferior thyroid artery. And what is the T for? Transverse cervical artery. Now this transverse cervical artery, which they have written as cervico-dorsal trunk, this is actually the transverse cervical artery, which we'll discuss in a while, because it can help us in scapular anastomosis, which is also helped by the suprascapular artery. So suprascapular artery and transverse cervical artery, they can help us in scapular anastomosis. But now our focus should go towards the axillary artery. As you come here and start discussing axillary artery, what is the extent of axillary artery? As we said, it is going to be the outer border of the first rib. So that is where axillary artery begins. And where is it ending? Lower border of the teres major, because after that it will continue as brachial artery. So this axillary artery, what are the 3 branches? The first branch which comes from the axillary artery is superior thoracic artery. We'll draw a diagram and name it. Then what are the 2 branches from the second part of the axillary artery? Under cover of a muscle called pectoralis minor, and the second part, as you see, is giving us the branches. You will find there is one which is called as the thoracoacromial artery, and there is one which is called as the lateral thoracic artery. Actually, lateral thoracic artery will be the chief artery to supply the mammary gland, along with the internal thoracic artery. So internal thoracic artery and the lateral thoracic artery, they are chief arteries to supply mammary gland. So second part giving 2 branches. What are the 3 branches from the third part of the axillary artery? As you talk about the third part now, one branch going under the scapula. So we'll call it as underscapular subscapular artery. And then the other 2, they are anterior and posterior circumflex humeral arteries. Now when you say anterior posterior circumflex humeral artery, there's a question asking, where do they make the anastomosis? And they make the anastomosis around the surgical neck of the humerus bone. So that is anterior posterior circumflex humeral artery coming from the third part of the axillary artery, along with the subscapular artery. Now once you have this much detail here, we will draw a diagram for sit with branches. We'll draw a diagram for 6 branches of axillary artery. But then as you proceed further, crossing the lower border of teres major, it will continue as the artery called as the brachial artery. And this brachial artery is reaching the cubital fossa, dividing into 2 branches. As you can reach there, now as you'll remember, this is the brachial artery, which is now dividing into 2 branches. In front of the elbow joint, cubital fossa. But before that, it will be giving one branch which was passing posterior to the humerus bone. So what was the name of this deep artery of the arm? The brachial artery giving the deep artery of the arm is called as the profunda brachial artery. And then it is going posterior to the humerus bone in the radial groove. It will be giving 2 collateral arteries, and the name can come as middle and radial collateral arteries. So the middle and radial collateral arteries are branches of profunda brachial artery. What about the ulnar recurrent arteries? If you say ulnar recurrent arteries, then it will be towards ulnar bone, medial side. And if it is the collateral arteries, there are 2 collateral arteries and there are 2 recurrent arteries. If you say collateral, they came from the higher level, like this was middle radial collateral, and this will come from the higher level collateral arteries, basically directly from the brachial artery. So it is the brachial artery itself giving the collateral arteries, but on the ulnar side, namely superior inferior ulnar collateral artery. So four collateral arteries. There is the superior inferior ulnar collateral arteries directly from the brachial artery, whereas there are two more collateral arteries which are middle, radial, and that is from the profunda brachial artery. Then what about the recurrent? Recurrent means you have come here and going back. You have come here and going back. So who is going back? The ulnar recurrent artery and radial recurrent artery. Obviously, radial recurrent artery will be going back from the radial artery. So radial recurrent is a branch of the radial artery going back, and ulnar recurrent will be branch of ulnar artery going back. Otherwise, ulnar artery is more important than radial artery here. See, just remember one thing clearly. Here, the radial artery give only one branch, which is radial recurrent artery. Otherwise, most of the branches given are from the ulnar artery. So ulnar artery giving which branches? Like we said, it is recurrent arteries. What are the names? There is anterior posterior recurrent arteries. And what else it will give? Ulnar artery is now giving us common interosseous artery, and this common interosseous artery divides into two, anterior and posterior interosseous artery. Now anterior interosseous artery you can see here because it is running anterior to the interosseous membrane here, but posterior interosseous artery will be seen posterior forearm. So my point is simple. See, questions will come here like they are asking, radial recurrent artery is a branch of, you say radial recurrent artery is a branch of radial artery, but this is the only branch radial artery gave. All the branches otherwise come from ulnar artery. Like which one? Like there is anterior posterior ulnar recurrent artery, and then there is common interosseous artery giving anterior posterior interosseous artery. They all come from ulnar artery. Now, what is ulnar artery doing when we come towards the hand here? It will form the social palmar arch. Now, when you say the ulnar artery, as you can follow, let us say this is the ulnar artery now with the ulnar bone and forming the social palmar arch. Superficial palmar arch is going to supply 1, 2, 3.5 fingers in the hand. Remember that the ulnar artery, when it enters the palm, from the superficial palmar arch will supply 3.5 fingers. Then who will supply 1.5 fingers? For the 1.5 fingers, for the thumb you have princeps pollicis artery. Okay, then who is giving the princeps pollicis artery? For the index finger, you'll have the radialis indicis artery. Now, princeps pollicis or radialis indicis, who is giving these branches to 1.5 finger? Obviously, none other than the radial artery running with the radius bone. So, as you see, radial artery giving 1.5 finger supply, whereas the ulnar artery giving 3.5 finger supply. So this was some basics, but then we need to move further. Tell me which test we are doing here. We got a question also. This test, there was a question, I'll show you the question also, but this is what we call as the Allen test. And why do you do Allen test? Allen test is done before we take the radial artery blood sample for arterial blood gas analysis. But then you have to be careful. See, when you take a sample from the radial artery, there might be a thrombus developing, and because of thrombus, the thumb area can go into ischemia. But that doesn't happen. Even if you have a radial artery thrombus, the thumb will not go into ischemia. And why not? Because the ulnar artery is patent enough not only to supply 3.5 finger here, it can supply 1.5 finger also in emergency. And that, how do you check that it can supply the thumb in emergency? That is what you do Allen test for. So Allen test is done to check for what? The anastomosis between superficial and deep palmar arch, point 1. It is the anastomosis between radial and ulnar artery, point 2. And number 3, the Allen test is checking the patency of which artery? Allen test is checking the patency of ulnar artery. Is it not checking the patency of radial artery? Yes, it is. I'll talk about that also. But somebody asking you Allen test, you must tell ulnar artery patency. So how do I do it? You ask the patient to make a fist, and then you block both the arteries, radial ulnar both. So what will happen? Ask the patient to open the hand. So as the patient will open hand, you already have blocked the arteries. The name of those arteries were, say, on this side the radial artery is blocked, and on the other side ulnar artery is blocked. But if you block both the arteries, the hand will become pale. See, this is a pale hand now. Why it is pale? Because you block both the arteries. Now release the ulnar artery, and as you release the ulnar artery forming the superficial palmar arch will definitely supply 3.5 finger. And what about the 1.5 finger then? What about 1.5? That should be supplied by radial artery. Now if you say the 1.5 should be supplied by radial artery, how can radial artery supply that? Because that area is already blocked. You have blocked the radial artery. How will you supply 1.5 fingers now? You still can. This is the principle. You will find that the pale hand has now become, this pale hand has now become red. And why it became red? Because you release the ulnar artery, so it became red. Even the thumb became red. But how the thumb became red? Despite the fact that I have already blocked the radial artery. Maybe you have blocked the radial artery, but thumb will become red because of communication of superficial deep palmar arch. This time patency of ulnar artery is enough to supply the thumb also. Allen test negative. Allen test negative means normal. So if it is normal, go ahead with the sample. You take this sample, even if thrombus develop, no problem, because thumb can be saved by ulnar artery. But very few people you will find that thumb still remains pale. And why the thumb will remain pale? Because in very few people this thumb is depending upon radial artery. If you block the radial artery, it will not become red. That tells you don't take sample here. Allen test has become positive, and when the Allen test become positive, it is dangerous to take this sample. Allen test positive means the thumb was pale. Very few people will be pale. It means it depends upon radial artery. You cannot take sample here. Allen test has become positive. There is a danger of putting the thumb at risk of injury. Now what is this? This is reverse Allen test. A reverse Allen test means what are you checking here? Patency of the radial artery. And how will you check the patency of radial artery? I will check the patency of radial artery by releasing the radial artery. Okay, so you block the ulnar artery. Yeah, it is already blocked. So radial artery, you release the block. Now you are checking patency of radial artery. What is this called? This is called as reverse Allen test. Now, if the reverse R for R, reverse for radial artery, what are you trying to check here? What I'm trying to check here is it will supply the thumb and index finger. That is obvious. But it is also now supplying the other fingers. Means which finger it is supplying? The 3.5 fingers also. But why is it supplying? Isn't that supposed to be supplied by radial ulnar artery? Yeah, but ulnar artery is blocked. You have blocked it. So this is a block in the ulnar artery. You are checking patency of which artery? radial artery is capable of supplying entire hand because of anastomosis between superficial deep palmar arch. This is called reverse Allen test. Now, why should we learn all that? Because of questions. Most of the time, we learn all these things because of the question. Let me show you the question itself, and you are going to tell me the answer now. So, tell me, what is the answer to this question? You are doing Allen test for checking what? Tell me. Allen test is done for very good. You already have answered. So, right, patency of the ulnar artery, got it. But then you should know that it is B as well as C, but B is a better answer than C. Now, why B is a better answer than C? Because Allen test is basically done before you take arterial blood gas analysis sample. You are suspecting radial artery will be undergoing thrombosis. That is why you check the patency of ulnar artery. And if it is not available, then you can go for choice number C also. That is also the answer. But it will be more specifically an answer if somebody has asked you reverse Allen test. So this question has come. Reverse Allen test. Which artery do you check patency of? In reverse, R for R. Reverse is for radial artery. So in this question, you have double answer. Be careful. And in that also, B is a better answer than C, because normally Allen test is for checking patency of ulnar artery before you take radial artery blood sample. That is why. Otherwise, the C is a specific answer for reverse Allen test. So, examiners, they keep playing some tricks, and you must be ready with the answers. Now, as we proceed further, you will see this is one dissected specimen, and in that dissected specimen, these days some questions are coming, so you should be able to identify front view of the right hand showing some relations of the artery and the muscles and also the nerves. So let us discuss the radial artery first. As you say, the radial artery, you see here, this is the radial artery towards the radius bone. Radius bone is a lateral bone. So laterally, you see, this is the radial artery. How do you identify radial artery or the radius bone? And then what it does, it will be, here you can take the pulse of the radial artery. It is going towards the posterior side of the hand and become a content of anatomical snub box. So it is going like this, becoming a content of anatomical snub box. Where is it going? Dorsal of the hand. And where it will come back again? Into the anterior palm. And what it will be forming there? The deep palmar arch. Not visible here because it is quite deep. Then what is visible here? The superficial. And what about the superficial? As you will see, now we have to follow ulnar artery. And where is it? It is with the ulnar bone. Now if it is the ulnar artery with the ulnar bone, what else will be running along with that? That will be the ulnar nerve. So as you see, this is the ulnar nerve. Now remember, this ulnar nerve and ulnar artery, both of them pass superficial to flexor retinaculum in a canal called Guyon's canal. There is a Guyon's canal superficial to flexor retinaculum, and both of them will be passing superficial. Then what is passing deep to the flexor retinaculum? That is a nerve in the midline. And which is the nerve in the midline? Median nerve. So as you say, this is the median nerve, and it is in the midline, and it is passing deep to the flexor retinaculum. In carpal tunnel syndrome, which nerve is involved? Deep to the tunnel. that is the median nerve. And why not the ulnar nerve involved? Because ulnar nerve is not in the tunnel. It is passing superficial to the flexor retinaculum. It can be involved in Guyon's canal syndrome. Okay, now what is this ulnar artery doing? As you will see, we are following the ulnar artery. This is the ulnar artery which came, and it is forming the superficial palmar arch. And as it is forming superficial palmar arch, how many fingers it will supply? 3.5. Which 3.5 it will supply? It will supply the ulnar side and radial side of little finger, and then it will be supplying ulnar side and the radial side of the ring finger, and then it will be supplying the middle finger, and it will be also supplying the index finger, but only the ulnar side. If the superficial palmar arch ulnar artery giving branches, then what about the radial side of the index finger? There's an artery, and what is the name of that artery? That is called as the radialis indicis. And who is giving the radialis indicis? That, along with the princeps pollicis, will be coming from the radial artery. Radial artery 1.5 finger? Yes. And that 1.5 finger is from the radial artery deep palmar arch. And these two arches, they do have some anastomosis, which we were checking by doing this Allen test there. So in this diagram, the purpose was to give you some idea, but this is not a diagram you'll get in the exam with labels. In the exam, there are no labels. So labels are there, A, B, C, D is there. So in that case, how will you identify? That is a problem. Let me show you. The examiner gives you this kind of a diagram. Now, if this is the diagram, examiner is giving, who am I? Some superpower, there are so many Superman or Batman or Catwoman that I will be able to identify all this. What is happening? What is all this? So remember that in the dissection hall, you can identify by looking and by feeling. So what I look for? You have to understand this. If there is a flat thing and very shiny, very whitish, so a flat thing and very shiny, very whitish and continuous with the muscle, then it will be muscle becoming a tendon. So how to identify a tendon? Usually flat and solid, and it is very shiny, whitish. Okay, then what is this tendon here? What is it doing? It is forming in the palmar aponeurosis. Who is forming palmar aponeurosis? That is the tendon of palmaris longus. So tendon of palmaris longus this is? Yes, I identified a tendon. Then how do you identify the artery? Let me show you one artery here, and you will notice this is one artery. Now you are telling this is artery. How will I know this is an artery? This is an artery here. But how will I know that it is an artery? Can't see nothing at all. So that is a big issue, and maybe as I zoom the diagram become blurred, but this is the radial artery here, and that is the ulnar artery here. Slightly pinkish hue. So they'll have pinkish hue, yes. And what is this side? There is another structure which is not very pinkish, but slightly it will be whitish. See, the most whitish tendon, less whitish the nerve, and pinkish, that is the artery. But I can't see nothing here. What is this? You have colored everything. So as you see, let me take out the colors, and you will find that we were talking about these structures, and obviously it's difficult, but then we have to train our eyes, and that is how we identify. So maybe you will be looking at multiple practice MCQs, and the more MCQs you practice, then you realize that we were talking about basically the ulnar nerve here passing superficial to flexor retinaculum, the ulnar artery here passing superficial to flexor retinaculum. Then we could also see that this is the radial artery, which will come here but then become a content of an anatomical snub box going posteriorly. So just have some idea, this is the palmar aponeurosis we were talking about. So you have to practice many MCQs. That is the only way we can actually master our expertise in dealing with the MCQs. Now let me see, we are almost the time is finishing. So let me draw a quick diagram now, which will be for the, it is a kind of a summary. Let us do that. And you will start with the, say this is the midline of the body. Now if that is the midline of the body, let us focus upon right-sided arterial tree then. And as we start, we know in the neck region there will be this subclavian artery, and this subclavian artery, as it is crossing the outer border of first rib to enter the axilla, it will become the axillary artery, and this, as it crosses the lower border of teres major, it will become the brachial artery. See, my point is, this is rib 1. So my point is that this is the axillary artery, and it will be covered by a muscle. That name of that muscle is, as we know, pectoralis minor muscle. And because of that pectoralis minor, let me zoom this area now so that we can discuss. What about the muscle which was covering subclavian artery? The name of that muscle was the scalenus anterior. Now if that is the scalenus anterior dividing subclavian artery into 3 parts, there is the pectoralis minor dividing axillary artery into 3 parts. What are the branches from the first part of the subclavian artery? The width branches. And in the width branches, what is this V going up? The vertebral artery to circle of Willis in the brain. And what is this I coming down? It is going to supply mammary gland here. So it is the internal mammary artery or internal thoracic artery. And what about this artery here in the width branches? What is T? T is the thyrocervical trunk. Thyrocervical trunk itself will give us SIT branches, and you can tell what is that SIT branches then. As you talk about the S and I and the T branches, you will find this S, suprascapular artery forming scapular anastomosis, I, inferior thyroid artery supplying thyroid gland, and T, transverse cervical artery. Sometimes it will participate in scapular anastomosis. So with SIT branches, in the width, the T has given SIT branches. Now let us come to the axillary artery. As you are talking about the axillary artery is having 3 parts. What is the first part giving? 1 branch. Second part, 2 branches. Third part, 3 branches. So what is the name of this first branch? Superior thoracic artery supplying mammary gland. So which arteries supply mammary gland? Many. Yeah, but which arteries supply mammary gland? Basically internal thoracic and lateral thoracic. And where is lateral thoracic coming from? See, superior thoracic is from the first part. The second part will be giving us 2 branches. As you see, one of them is lateral thoracic artery and the other one is acromiothoracic artery. But both of them will supply mammary gland. So under cover of pectoralis minor muscle, 2 branches given, lateral thoracic, acromiothoracic, supplying the mammary gland. Mammary gland is supplied by 1 more artery. Which one? Coming from the third part. But third part will give 3 branches. What are the 3 branches from the third part of the axillary artery? And as you see, the 3 branches from the axillary artery, one of that is underscapular, so we say subscapular artery, and then there are 2 branches going around the humerus bone, and we call them as anterior and posterior. Circumflex humeral artery, anterior and posterior circumflexural artery branches from the third part of axillary artery. And subscapular artery, is it supplying the mammary gland? Yes, it is supplying the mammary gland because it is written by Gray's anatomy. So tell me which artery supply the mammary gland? They are subscapular artery, but chiefly lateral thoracic, antral thoracic. You are missing one more, which is a group of arteries supplying mammary gland. So what is that group of arteries supplying mammary gland which we have missed? You know, in the thorax there is a descending thoracic aorta, and it will give pica branches. And what is this pica? From posterior to anterior they'll come posterior intercostal arteries, posterior intercostal arteries, branches of descending thoracic aorta and supplying mammary gland. So mammary gland is also supplied by pica, the posterior intercostal arteries, branches of descending thoracic aorta. Yes, it is a highly vascular structure. Now, after crossing the lower border of teres major, what is this artery here? That will be the brachial artery. And brachial artery, as it becomes a content of the anatomic, this cubital fossa here, it will be dividing into two branches. So brachial artery come to the cubital fossa, and in the cubital fossa, as you will see, it is giving two branches now. Obviously, if you are towards the radius bone, radial artery, and if you are towards the ulnar bone, ulnar artery. Now tell me, which branches were given here? The radial artery gave only one branch, and what was the name of that branch? Coming back towards the elbow. So what is this back? Recurrent. What recurrent? Radial recurrent artery. Otherwise, all the arteries which you see here are given by ulnar artery. So ulnar artery gave which branches? Recurrent. Which recurrent it was giving? It was giving anterior and posterior. Anterior and posterior what? Anterior and posterior recurrent artery, but from the ulnar side. So anterior ulnar recurrent artery, posterior ulnar recurrent artery, making anastomosis around the elbow joint. MCQs. What else the ulnar artery gave? You saw. It was giving a branch which was called as the common interosseous artery. And what is the common interosseous artery doing? It is giving two branches. And the name of the two branches? Anterior interosseous artery, anterior forearm, and posterior interosseous artery, posterior forearm. So both of them came from the common interosseous, came from ulnar artery. My point is, ulnar artery giving so many branches, but radial artery giving only one branch, which is radial recurrent artery. Sometimes it's better to remember the exception. If you remember the exception, whatever other names are, all coming from ulnar artery. Remembering these names, better remember one name. Radial recurrent is from radial, that's all. Rest of them will come from ulnar. Anyhow, now once you are through this as well, you know, as you proceed further, you will find the ulnar artery would have formed the superficial palmar arch, and then the radial artery would have formed the deep palmar arch. And as you already have mentioned, let me zoom this area. You will notice that if it is the deep palmar arch, it will give branch princeps pollicis for the thumb, and this finger also radial side, name is radialis indicis. So princeps pollicis and radialis indicis, that is 1.5 finger. Otherwise 3.5 fingers, which artery is supplying? Superficial palmar arch. And the name of those, you can just remember, like you can say, this will be the little finger, then the ring finger, then middle finger, and also part of the index finger, the ulnar side of the 3.5 arteries supplied. 3 fingers are supplied by ulnar artery, superficial palmar arch. So this is kind of a revision which we could do. Now, since we already have overstretched the time, I am here. You can ask me, so what is another branch from common interosseous artery? What is another branch from common interosseous artery? See, there sometime a question comes, it will ask you interosseous recurrent artery. Interosseous recurrent artery. There are 4 recurrent arteries. One is the anterior, one is posterior ulnar recurrent artery. Then there is radial recurrent artery. There is one interosseous recurrent artery also. Now, if you say there is interosseous recurrent artery also, who gave that is a question. I think it is All India PG, that NEET pattern question. See, my point is, for recurrent arteries, they are called recurrent because going back. So radial recurrent, branch from radial, and anterior posterior ulnar recurrent from ulnar. My point is, recurrent interosseous artery, where is it coming from? And you should answer it as posterior interosseous artery. Posterior interosseous artery. This one is giving us the interosseous recurrent artery. Came as a question. So interosseous recurrent artery is obviously going backward for elbow anastomosis, is a branch of posterior interosseous artery, is a branch of common interosseous artery, is a branch of ulnar artery. Maybe that is what you were asking here. Okay. So questions now. Kindly, we have some 10 more minutes, 15 minutes. Ask me questions. Actually, the chat goes so fast, it is so difficult to a smooth sea will never make a skilled sailor. If you want to become a skilled sailor like China, South Sea, they are the people who will be fighting with anybody and everybody. I used to think that only North Korea does that, but now this Xi Jinping, the president of China, they are fighting with everybody. Australia, you come. New Zealand, you also come. Japan, come here. Korea, come here. India, you also. America, where are you? Japan to this America. European people also. Don't worry, come, let us fight. Have a fight in the sea. Anyway, so if there is any stab wounds on right side neck, which vessel most probably injured? Stab wound in the right side neck, which vessel? Now you have to specify like which stab wound you are talking about. If it is in the posterior triangle, then most probably you'll be compromising the subclavian artery. Subclavian artery can be compromised, especially the third part of subclavian artery. But you have to specify like which area you are talking about. And maybe it will happen that in the chat, some of the chat I can see because it is a limited screen. If I'm unable to answer, I'll go back and check and write the answers back. So just keep checking the chat box and I'll be answering everything. Whatever you ask, I'll answer definitely. If something is missed, I'll answer. But let me see. Relation of axillary artery with brachial plexus. Relation of axillary artery with brachial plexus, I told you that axillary artery is in the axilla. So it will be related to the three cords of brachial plexus. If the cord is lateral or medial or posterior. So lateral cord of brachial plexus becoming musculocutaneous nerve, and medial cord of brachial plexus becoming ulnar nerve, and posterior cord of brachial plexus becoming the radial nerve. So three cords of brachial plexus relates to axillary artery. You can watch this session again because it will be on YouTube. You can watch it again. Sir, how to determine side dissected specimen of hand if distal part of hand not given? Side. But why do you want to find the side of the hand? See, whichever hand is given, how does it matter? Just see the thumb, radial side, radial artery. Little finger, ulnar side. Doesn't matter whether it is right hand or left hand. Obviously, you can make out that which is right and left hand, but it is not required. Why you want to know that? आपका चैनल 350 करोड़ में बिक गया क्या? ये क्या सवाल है भाई? 350 करोड़ तो बहुत कम होते हैं. जिसने बेचा है उससे नहीं, ऐसे मैं ऐसी बातें नहीं करता. मुझे कोई खबर नहीं सच में। देखिए मैं दुनिया से अलग आदमी हूँ। एक ये कमरा है मेरा, इस कमरे में रहता हूँ, मुझे पता ही नहीं कि क्या हो रहा है वहाँ पे। बहुत सारी बातें चल रही हैं, कितने करोड़, कितने मिलियन, कितने बिलियन, ट्रिलियन, और क्या हो रहा है जानकारी है, पर आई एम नॉट इंटरेस्टेड। आई एम अ टीचर, आई एम सपोज टू टीच, आई एम नॉट इंटरेस्टेड। आई राइट एवरीवेयर। जो करना है करो, जिसने जितने पैसे बांटने बांट लो, मुझे नहीं चाहिए, मुझे पढ़ाने दो बस। मुझे एक मौका दे दो स्टूडेंट को पढ़ाने का, थोड़े बहुत पैसे देने हैं तो दे दो मेरी जेब में, मगर करोड़ों में तो नहीं चाहिए। What about veins? भाई आज की क्लास आर्टरीज के ऊपर थी. This class was on arteries. Maybe veins we can discuss in the next class, but this class was for arteries. Please discuss other two branches of subclavian artery. Other two parts of subclavian artery. So first part of subclavian artery, second part of subclavian artery, third part. See, second part, there will be some branches which will be going towards the thorax, like you have superior intercostal arteries, and there is one branch which is going towards the neck, ascending cervical artery. So second part of the subclavian artery, they will be giving some branches towards the thorax, towards the neck region, superior intercostal arteries and ascending cervical arteries. Third part of the subclavian artery, give a very important branch, dorsal scapular artery. So subclavian artery, which is divided into three parts by scalenus and anterior muscle, the third part will be giving us one important branch, dorsal scapular artery. It will go dorsal to scapula and participate in scapular anastomosis. A statement of Gray's anatomy. Dorsal scapular artery participating in scapular anastomosis is usually a branch from third part of subclavian artery. Came as a question, though dorsal scapular artery can also come from first part of subclavian, but usually from third part of subclavian. Which artery mostly involved in acute limb ischemia? I don't know like what you are trying to ask. Which artery mostly involved in acute limb ischemia? What is the etiology? Why there is acute limb ischemia? Say there is a supracondylar fracture. In that supracondylar fracture, there can be injury to the brachial artery. And if the brachial artery is compromised, then there will be acute, you cannot say acute limb ischemia, but there will be limb ischemia, that Volkmann ischemic contracture, all those things can happen, compartment syndrome. But as you are asking that which is the most common artery in the upper limb for acute limb ischemia, you have to give me choices. Actually, I am not getting the question. Raynaud syndrome. Raynaud syndrome is actually what happens is, like mostly in females, there will be overactivity of sympathetic system, sympathetic vasoconstriction. And since there is sympathetic vasoconstriction, especially the tip of the fingers, which are usually pink, they will become the gangrenous, black and gangrenous. You may have to amputate also. So what happens in Raynaud phenomena, due to sympathetic overactivity, sympathetic vasoconstriction, the arteries are occluded, spasmodic, and there is some chance of ischemia. You don't want the amputation and all that. So for Raynaud phenomena, what you can do is you can give stellate ganglion block. When you give stellate ganglion block, you are blocking the sympathetic fibers for the upper limb arteries, which were causing vasoconstriction. So if you remove the vasoconstriction, the fingers will again become pink color. So stellate ganglion block can take care of two things: hyperhidrosis, more sweating in the hand. It can also take care of sympathetic vasoconstriction. That is indication of stellate ganglion block. Sir, if only radial artery involved in thrombosis, if involved, what is the alternative? See, usually the Allen test will be positive only one hand. If the Allen test has become positive in one side, you can take the sample from other side. 99% time this will be normal, means anastomosis will be intact. Allen tests rarely become positive on both sides. Usually it is positive on one side. Don't take sample from here, take the sample from other side. It will be normal in the patient. Okay, so what we can do is, whatever questions I have missed, I will be going through them and trying to find the answer if there are some questions which I couldn't answer, and I will write down all the answers in the chat. This video is going to be there and the answers are going to be put maybe next 1-2 days I'll take, and then just go through it. Thank you very much for your precious time that you have spent with me. I'm hopeful that whatever we could discuss today will help you in the upcoming exam, which is in November and maybe the next year, January. And definitely few questions will come from this discussion itself. All the best. It's always a pleasure being with you. Thank you. Thank you. Take care.